I'm a third-generation dentist, and I'm going to tell you about fillings and why we have to have a filling and why it needs to be done. So basically, here you see on this, these are the fissures of the teeth, these grooves. And what can happen to teeth is things can gather in these whole area, fissures, and bacteria gather, and if you have sugar as well, you get caries, which is decay of the teeth. When you have decay of the teeth, that creates a hole. That decay can basically progress towards the nerve of the tooth, and that's why you get pain. So what we need to do is clean out the decay and stop it progressing, and that's a filling. We anaesthetise the area, and you can have that numbness. We clean out the tooth, all the decay, and then we put something in to seal it. Sealed, we polish the area, and we check occlusion. Occlusion is the bite of the teeth, so we check how one tooth moves against another. And what we also talk about is aftercare of your filling. You've really got to keep your sugar intake low. You want to obviously brush the teeth twice a day. Keeping them really nice and clean is important. Mouthwash is a great thing as well to using mouthwash. I recommend alcohol-free because the alcohol over time can actually affect the soft tissues. So using an alcohol mouthwash every day can damage the soft tissues. So it's better to use an alcohol-free one. Now, there have been these recent articles that have said that flossing the teeth isn't a good thing to do, but I can definitely say that's wrong. Flossing the teeth is really important. It's 40% of the teeth is actually between the teeth. So if you're just brushing the teeth, you're not getting between the teeth and cleaning out that area. So you do need something, we call it interdental cleaning, which is cleaning between the surface of the teeth, and you need something to get between the teeth. Things that stain teeth, smoking is one of the main things that stains teeth. So, you know, we always advise patients obviously to stop smoking is ideal. Black coffee and black tea are worse than milky tea and coffee. So if you've got having milky tea and coffee, it doesn't stain the teeth nearly so much. Obviously curries, you know, especially with heavy food colouring in, they can really stain the teeth as well. When we're doing whitening, we actually put our patients on a diet of white foods, chicken, rice, fish. I tell them water, obviously white wine, vodka, tequila, gin, those things as well, of course, are clear, but yeah, basically red wine is the one that really stains the teeth in that case. So that diet can help the teeth. And there are foods that naturally cleanse the teeth. Strawberries contain malic acid, which is a naturally cleansing solution for the teeth. Apples as well. Foods like cheese contain calcium. Cheese and milk contain calcium, so those really help the teeth. Nuts can also, because of they're quite hard, these foods can help clean the teeth. Celery, there's a lot of water in celery, and while you're eating it, it performs a natural cleansing action of the teeth. So that's another really great thing to do. And just generally brushing twice a day, eating healthy, really thinking about your teeth, trying to treat them well.